the agenda. I'm gonna turn it over to Harry since he's the chair of the executive committee.
All right.
And let him take from there.
No,
There are.
that is where we start here.
Well,
You're gonna start with
What's
the
from
tax
the tab,
anticipation
yes.
note borrowing. So you have the
Yep.
treasurer present, sorry,
the
okay, and the
anticipation,
deputy
No.
treasurer.
the tan thing. You want me to do it?
Yeah, go ahead.
Okay.
I wasn't.
I'm gonna go ahead and take over for the executive committee. Since I'm
Into the
the
clerk
clerk
first.
anyway, and call that to order. Before we start, will we stand up to Mike, we can do the pledge of allegiance.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands,
one nation, under God,
indivisible, with liberty and justice for all.
So with that, I'm gonna turn it over to the treasurer and let him tell us what he needs to know about what we need to know.
Okay, thank you. Can you hear me okay?
Yes.
Yes.
Okay, in anticipation of this meeting, I sent out a memo along with a historical listing of the county's previous borrowings and also a cash flow statement showing where and when the county will need to borrow money in order to fund operations. I met with the commissioners back in November and reviewed similar information with them. And at that time, they had endorsed the county's need to borrow up to $16 million in anticipation of taxes. So what I'm asking from the executive committee today is your approval or your vote to allow the county to borrow up to $16 million in anticipation of taxes for 2025. I'll try to answer any questions you might have.
What is the expected interest rate on that money?
Well, what we've got so far is we anticipate interest rates to be somewhere between 4.25% and 4.75%, similar to last year.
If I may, in this historical tax anticipation report, it's a spreadsheet. How many of these loans have they all been paid off? And if
Yes,
not, once.
What happens every year is the county borrows money sometime in the springtime to fund operations for the remainder of the year. And then in November, we send out tax bills to all of the communities within Belknap County, and they submit their tax payments to the county sometime in early December. So yes, every year the borrowings are paid off in December of the same year.
So
Unlike municipalities, the county only gets tax dollars at the end of the year, that we don't get anything mid-year.
okay, so if I was looking at 2024, just as an example, so I'm testing my understanding.
Okay,
It looks like the executive committee approved about 14 million.
correct.
And the closing date was 3/14 of 2024 and 9/19 of 2024. So there's 2 draws on that amount, and each one was closed.
Correct. That's
And
correct.
then for the amount of time that we had those loans or used it, a draw, we had an interest rate on the top line of 336,000, and then second line was 66.3.
That's correct. That's correct.
Okay. So to further test my understanding, what we're looking for today is how much?
16 million,
Up to.
up to 16 million. What ends up happening is our bond counsel advises us as to the limits of our ability to borrow based on a projected cash flow statement. So this projected, and basically initially, all we can borrow is whatever our projected needs are 6 months out. So if you look at February, if you look out 6 months from February into August, you see that our needs by the end of August are somewhere around $9 million. So the initial borrowing that the county will do in sometime in February or early March will be to borrow around $9 million. And then additional funds may or may not become necessary by the end of the year, in which case there'll be an additional advance later in the year.
Then that would be based on that. We believe we're gonna get $16 million in available cash by the end of the year to repay one or two, both of the loans if it's due.
Correct. If you look at your budget, one of the line items on your budget are the funds that are to be raised from taxes. That's the dollar amount that all of the municipalities within Belknap County will be billed in October, November, and those payments are due in December from the various towns and cities. So that will cover the cost of the borrowing.
We have any other questions?
What would happen if we did 14 million? Same as last year.
Well, we're anticipating that we're going to need more than 14 million. So all that would mean is if you approved 14 million for this year, we would probably have to come back to you later in the year and request additional borrowing.
What are you basing the 16 million on?
On a cash flow statement.
The proposed budget?
No, this cash.
So it's not tied to budget, it's tied to cash flow. And recognizing that I don't know what the final number is in the budget for funds that are going to be raised from taxes, but I assume it's somewhere in excess of $16 million. I don't have a copy of the budget in front of me, and I know you're working on that right now, and I don't know what that number is, but I'm going to guess it's somewhere around 18 or 20 million.
Or 22.
So I'm noting in this memo, it says projecting a need for up to 17.5 mil. So why?
Well, there's two things. One of the when I originally went before the commissioners back in November, we still had a significant amount of ARPA money, cash that we had on hand. And since COVID and since we first received the ARPA money back in 2021, we've been using that cash that has not yet been distributed as cash that we could use cover our short-term borrowing needs so that we didn't have to borrow money. That's why if you look back 2021, 22, the dollar amounts that we ended up finally having to borrow was significantly below what was requested. And it was because we had that ARPA money. Well, in November, when I went to the commissioners, we still had some ARPA money that had not yet been distributed, and now it has been. So there may be a need for us to come back later on. If that 17.5 million holds up through the end of the year, we may have to come back and ask to borrow more, even if the 16 million is approved. We might have to come back and request an additional borrowing. So all I'm asking for today is the original amount that the commissioners approved or endorsed. And if we need to borrow more than that, then I can always come back before the end of the year and request that. So that's where the difference in the two numbers, because the cash flow that I had back in November showed that by the end of the year we would need only 16 million, and since then that has changed because of the distribution of the ARPA money.
But since the commissioners only authorized borrowing up to 16 million, the treasurer really can't ask you for any more than that. So even though it looks like we could possibly need more, at this point, the most he can request is 16 million.
So if we did 15, and it comes to 17.5, we could do 2.5 later. Is that?
Yeah, if you
Correct.
definitely want to have another meeting, then you could go for less than 16. But we do know
Let's see
that
if we can shoot for 2.
I mean, I don't want to force any kind of decision on the committee, but I mean, I've been doing this for 18 years. And I've really never had the executive committee reduce the amount that we request only for convenience and expeditious delivery of our needs. If the committee wants to have another meeting to discuss additional borrowing, there's no problem with that. It's just never really happened as long as I've been doing this.
Because it looks like
Yeah, I see.
from this spreadsheet, they take some,
I'm
and
good.
then if more is needed, they take some more out of it, and it out of the up to amount that we approve.
I just want to make sure I knew what I was doing.
Okay. Yes,
I'm gonna make a motion to approve the tax anticipation note up to $16 million.
I'll second that.
So let the notes indicate. All those in any discussion?
We had.
Okay.
Let's see.
All those in favor?
Aye.
Aye.
Let the records indicate that the executive committee passed the $16 million request.
Unanimous.
Was that unanimous?
Yes.
Okay,
Okay, great. Thank you. Appreciate your help.
thank you.
Thank you.
Such a resounding, right? Sounding.
Look at that.
Okay. As I'm looking at this, I'm gonna go ahead and, does anybody have any questions? We're gonna do the minutes. We've adjourned the executive committee at this time. And we're gonna reopen with the budget review committee. So with that, I'd like to go ahead and look at the approval of the minutes for 1/20/25, or we can put it off if you so wish and want to have a chance to look at it.
That's actually down on the agenda.
I know I'm used the chairman choice and moved it up. Flow through so I can get rid of quickly. So is there a motion to accept as written?
I'll make that a motion. Accept the meeting minutes for 1/20/25 as written.
I'll second.
We got a second, all those in favor? I let the,
Yes. And I'll abstain. Wasn't here.
let the record indicate that it passed 4-0-1. Okay. So that's done. This statement of appropriations is that for,
that's just an informational thing that if you want to see what the budget actually needs to look at when it gets submitted to the Department of Revenue Administration, that's last year's. So I just for an FYI.
okay, thank you very much. All right, so with that, we're gonna move right into the review of the nursing home budget.
Hi. Good afternoon.
You're on.
I wanted to introduce you to Amanda Gallagher. Amanda's the Director of Nursing, and she's kind of learning the position of administrator too in the budget works. Seeing all the inner workings.
Well, thank you very much and welcome aboard.
Skip by.
Are you
the,
going
debt
by-
service. Skip by debt service because they approved that with the county debt service.
Okay. We're starting with administration. Because we
Yep.
going a line by line.
Do you want her to
Do you-
read it down?
do
Do
you-
you want to ask questions as you have them?
We'll just ask questions as we go along and you just. You can start with full-time wages.
So full-time wages is for 8 staff members and part-time wages is for 3.
That was 8 and
There-
3.
8 and 3, there are no new positions.
5% increase, is that due to contractual agreements?
COLAs and merit raises.
Just wanted to make sure.
Pretty much the rest of it down through payroll tax. And that payroll tax.
Really to bed tax. We pay 5.5% on revenue.
So I see 40% of IT coordinator on right below full-time wages and then once again down under payroll. Is that the same?
Yes, same,
40%?
yes.
The
We capture
taxes.
40% of the IT person's salary.
Okay. Home insurance, workers' compensation. Explain the bed tax provider assessment, please.
So we pay 5.5% on revenue and we get quarterly. It's paid quarterly, January, April, July, and October. We receive a bill.
And that's the.
Revenue,
Uh, that's paid to the state,
yes.
the same as someone staying in a hotel or anything else. That's pretty close to the same.
Pretty close, similar. Yeah.
Like the rooms and meal tax.
Rooms and meal tax.
They get better meals.
Yeah,
better
they-
service here.
They have better rooms.
Okay.
I still find that unbelievable. That's just the
Yeah.
dumbest thing.
Yeah.
The dumbest thing. It's just,
Do we see any of that return back to us from the state in any form?
not to the county.
No,
I don't
No.
think it
and
goes
if
to
we
the
did,
county.
we'd get taxed on it.
Yeah, as we collect more revenue, they take more of our money. Yeah, you
I
can
wish-
work on that's.
So I have a question, I'm looking at
Controlled
some
by the
communications. Why are there 12 hotspots required?
No, that's 12 months. We have 4
Oh,
hotspots.
that cut you
Okay.
in.
All right,
Yeah,
we go with the numbers.
We
I
have
got
4
it.
hotspots and
I see 12
it's
to 75.
monthly.
Yeah, $75 a month.
Yeah.
We have track phone minutes as well as.
So we have a nursing track phone for nursing on call for the weekends. We have one that goes in the activities van. And we have 2 that we put in the safe for residents that come in that are skilled and want to have a phone. Because we can't hook up a phone that quick. So we lend them a track phone.
What is the first like?
Those are the phone systems, we got
The
those on
IP.
everything, instead of voice over IP phone system.
Okay. They just call it something different than everybody else.
No, everyone
No, it's the
has,
same
First
thing.
Light is the company
Right.
that ran the fiber optic line.
Charge the hospitals a bed tax?
So, you know that?
I don't know. Yeah, I don't know if they do.
You know, Mike, if they charge the hospitals a bed tax,
I can't say definitively. I can look it up.
I'd love to know the difference.
Well, we look forward to legislation.
I would, well, and I'm sure we'll be working on that together.
You want to
You might
eliminate a
find-
tax, Charlie?
I'm sorry,
You want to eliminate a tax?
I want to eliminate a stupid tax.
Perfect.
How about that?
Usually
It's
an
just- it's
expensive
like a
tax,
round
too.
robin thing. It makes no sense at all. Just-
Any facility with sleeping accommodation, so I would assume
No, no.
it would be a hospital. I mean, it's not definitive in here, but that's what I'm, just any facility with sleeping accommodation.
Our jail doesn't pay. They've slipped.
Oh, does assisted living pay it?
They have-
Valid point.
Assisted living doesn't pay it.
They're not very accommodating, but they do.
What's that? Who doesn't pay it?
Assisted living, that they sleep over there.
And you know that for a fact? You know,
Been out of it
Our
for a
researchers can find that out.
few years, but we didn't.
That's something we had to do while they got in a moment or two in their time because we got all the bills.
Yeah, I think they do. I don't think they do pay
They
it.
also have a Medicaid enhancement tax.
well, I'm just focusing on the beds, guys, because it's just-
They're gonna tax you to sleep in your bed, Charlie.
I'm sorry,
They're gonna tax you to sleep in your own bed at home.
again, I mean, we're talking about people in a nursing.
That's what the
home.
property tax is. Right?
It is.
I was thinking.
It's not like the nursing home is in the business to make a profit. They're providing a much needed service. It's just- I'm sorry, I'll let it go for a few minutes.
So, under, I'm up to software support, and those of you who are.
Yeah, I know,
already
you've seen it.
asking,
Yeah.
Then, can we go through the software support? Uh, uh, I don't know what some of these are, and some of them I do, but
Oh.
can you refresh me on, what this whole line of different softwares that we need?
Yep, so the Munis is our payroll that kind of is for employees. Chronos software is timekeeping. Medicare cost report is to be able to do the cost report that we have to do yearly. IN2L is it's never too late to learn, and it's what the activities department uses for the residents. It's a portable, kind of, if you think like a Wii type thing that they can take around and do different projects with them. Therapy can use it for them to stand and do balance. It has flight simulators on it. It has music on it, has DVDs on it. The resident's family can post like a Facebook page or a page on it so that they can access it and talk to their loved one.
Do we want to stop there and
Any,
ask that we're requesting an increase there? An $800 increase from the commissioner's recommended budget. Because the invoice came in after the commissioner's budget was prepared. And it's $800 higher than last year.
So that's the 6240?
Yes.
yes,
Okay.
fully managed.
$7,000.
No, the
62.
6240 reflects the increase.
Oh, it reflects it.
Yeah.
Fully managed are kiosks that you see in the hallway that the nursing staff put in their ADLs and they do their coding and it's their documentation on the residents. Point Click Care is our biggest system. It's the electronic medical records. So we have our pharmacy, we have all our resident records on it. Yearly claim shuttle, Lori, you probably know more about that, the claim shuttle.
Claim shuttle, that's what they use when they scrub their reports, when they submit billing for residents in the nursing home, so they scrub those. It creates less denial, so it means we get paid faster, in a nutshell.
Same thing as the Point Right, the MDS scrubber. We have to submit documentation on each resident. It's like 67 pages that talks about what the patient has with their diagnoses and all the care that they get. And that goes through to make sure that we're not missing anything so that the report is successful in being sent to the state. On-shift scheduling is the way we do our nursing schedule as far as assignments, and it also is our way of reaching everybody, contacting everybody for open shifts or emergencies. Everybody's on it, so they get a text message if we need something. Also, the staff can look at it and see if there's any open available shifts, and they can sign up for them. Secure Care is our Wanda Guard system for elopement for residents. They wear a bracelet, and it's at each of the doors where they could gain access to the outside. Zoom hosting is, as it says, Zoom. Adobe, that's our portion of the Adobe. Microsoft Office is our software. I believe it's like Excel, Word, Teams, all that. PBJ software is payroll-based journaling. That is what we put our software in to say what staff is working, how many hours, and it goes and it gets submitted to the state so that we can look at what our hours per resident day is. The Tech Plan Secure Care system, that is the call light system for residents, the light that they push to get a nurse. And the company that takes care of it is ESL Distributing.
So have we looked at, because I think I've asked this question in another area of the thing, but this looks like Kronos does a lot of this. That it seems like payroll, because one of these software packages is payroll, the other one's timekeeping, the other one is shifts and all of that. And then the availability of shifts that someone can type in and say, I'll take that shift and stuff like. Kronos itself does all that. Have we, it does, because we used it in private business and we used it so that people could use it for cross sections, filling in for openings, asking for vacation, asking for time off, and all of that. And I was just curious if we looked at the ability of Kronos
We have
as a
looked at-
package. Do we get a better pricing on that package versus?
We have looked at it. The modules that we buy from Kronos allow us to process the payroll and period, that's it. It doesn't do scheduling. We don't have any modules now. They may
Right.
make them, we
They
just don't
do.
have them.
They do.
And we're trying to move away from Kronos actually and plan to move to Munis to do our timekeeping.
So this looks extremely expensive.
Munis is our primary software that the whole county runs on. It does all the accounting, accounts payable, the budget, it does fixed assets, it does everything that we need. HR, right? Munis is what is the primary software used by the county as a whole. Kronos does our timekeeping. We are looking at buying a timekeeping module from Munis, and then we would get rid of Kronos.
So why did we have in another budget, we were adding all these new Kronos time clocks? I think it was for the nursing home.
We'll get one or the other. We're not gonna buy Kronos time clocks if we're sure we're moving to Munis. So that purchase is to allow us to buy time clocks from one company or the other. So we will be careful of that. Obviously, we're not gonna buy time clocks and then switch, right? And the on shift is scheduling software that maybe Kronos is capable of it, but we don't own them access to the module that does it.
But can Munis do that?
I don't know if Munis has a scheduling module or not. I don't know that. Do you know that?
I don't know that, but we did compare the Chronos scheduling module back when we did the on shift. and
Right.
It was nothing compared to this, and pricing was very similar. We did do that diligence as far as looking.
Okay, so,
It's in our best interest. We prefer to all have, if we can, everything we can get through Munis, since we're so committed to Munis at this point, that consistency would be better, even though Munis is nobody's favorite program. It's difficult.
so, okay, it sounds like you're looking at it, and do y'all have a, time frame that y'all were looking at? Making these moves a year from now, 2 years from now?
After the budget, but.
Yeah.
But probably during the summer, we will, look more at the time clock purchase, which will cause us to look more at moving to Munis.
It would take implementation, which will take time as well.
What is the overall cost of Munis to the county as a whole, and not just the nursing department?
I have the. let's see. Oh, just go to it.
That seems really high. That's just nursing department part of it. Business. You say that, but I.
Oh, do we have that? Oh, all right, here you go. It's, it's that 22,000 in the nursing home plus this 33.
Includes support. There's a substantial amount of support and training that comes with that too. So we're not just out on a limb trying to fend for ourselves with the.
Are they are they jacking it up every year, or are they?
I'm sure it went up. Yeah, you can see it went up last year. We spent 33,213, so it's a couple $100 more this year.
Okay, so that's not gouging.
What's that like?
They're not gouging them.
I know we're putting in a new software for the city, from the financial side.
Do you know what it is? Just out of curiosity.
I don't know what it is, but I know it's gonna allow them to do remote, that each department can then now put in their own numbers and stuff. And so they don't have to fill out a piece of paper and send it to someone else to put into a report, then someone else has to
It's a cloud
duplicate
base.
it.
So
But
they
I
may be
know
moving to Munis.
it was in the several $100,000 range, but it's something they can run a good portion of the city off of.
Of the city of Concord.
So it was, you can talk with Glenn,
When we bought Munis,
but it was
That
quite
was
expensive. to go.
225,000.
Yeah.
10 years ago.
And they still charge you 30
And
something
every
grand a
year, right.
That's for upgrades and support and, continuing use. I guess it's like Microsoft 365. You can't buy it anymore. You
Right.
have to rent it monthly or
Yeah.
something, but you get everything with it. Speaking of, Microsoft Office 365, are we able to use the team and remove the Zoom?
Yes. I think
Okay.
that's
Ooh,
reasonable.
$150.
Well, throughout each department, that might be $500. Anybody else had any questions about that section? Okay, moving on, IT system upgrade.
So this is one, with the VLANs to the FortiGate firewall, that's a necessity nowadays. It's $1,200. I got no issue with that.
Yep. IT renewals and hosting.
Subscription. No, there's nothing there that's all necessities.
So what's all works phone system maintenance if we're using What's that other?
First Light is the company, is like you would pay for your phone on a monthly basis. All Works phone system maintenance is the physical handsets. The phones have to be programmed, updated, they break, we have run into lots of service problems with them and we need to call the company, they charge us a fortune. So now we subscribe to the maintenance plan, which is, financially better for us than paying as we go. So this
Okay.
is
It's like a yearly-
40%.
Yeah, because to replace the.
So if phone
replace the
breaks, we
phones.
get a new one based off our insurance?
No, if it
No,
breaks, we have
it's
to
like
buy a new
400
one,
bucks.
then we buy a new one. Yeah, I think they were
350,
355
358.
the last time.
Yeah.
This is just to try to prevent them from breaking.
I think it's necessary.
And what's the last one there, that,
Meraki,
yeah,
that's
Wireless access points.
yeah, that's usually,
Yeah.
they used to be these Cisco Meraki's, that's, you need that's all access points and you're gonna stuff for. You have to pay a yearly subscription, even running nowadays, used to not have to, but. Used to be part of Cisco, I don't know, if they broke off or what. Still part of Cisco.
all right, any other questions?
I just have a comment, okay? Peter, you and I are about the same age. I know Steve and I are. We're close, probably. I'm listening to all these expenses, IT, tech, all that stuff. And I can't help but wonder, when we were kids, the nursing home was here, and I keep saying to myself, well, how the hell did they run it then? Without all this stuff, without all this expenses, I don't recall hearing about disasters at the nursing home, about the whole system collapsing on itself. It was operating as a nursing home. But, you know, how did we get sucked into this? I just don't get it. And
Just
sometimes,
like cell phones. We
Yeah,
grew
well,
up without them.
I-
We lived, right?
yeah.
But now we can't.
well,
And our
no,
kids really can't.
no,
We're taking them away from them.
yeah. If
We
I
become so dependent on them.
my point is that sometimes I wish that we could just set an example or bite the bullet and do less of this stuff and go back to.
Please don't make us be the ones.
But I mean, just,
Well, there's things that happen that now require these things, like the
Right.
PBJ, you know, or the claim shuttle, if we want to get paid well.
yeah,
And
yeah,
timely.
all by design, all by
Right, by
design.
CMS, that's
All
the
by
right
design.
requirement.
Or the nursing call
You
system, we
can't-
don't use the
you can't
bells
do
anymore.
this without paying me.
Yeah.
Correct.
Do this, and you know, and it's such a scam, and I know you guys do what you can to try to mitigate these expenses. With the help of Stephen and other prime members here, but I just. You know, if there's any way you could just say, you know what, we're not gonna do this anymore, we're gonna do it this way and save this money. And I know you chuckle about that, Mike, but you know, how much further along does this go?
So the
Where they
thing
just
is-
keep, you talked about gouging, but the reality is they get us to the point where, geez, I don't know what to do anymore, I guess we're gonna pay this.
So time is money as well, and this is actually, tools like this are actually saving time. So you can't really
Time for what,
equal the
the day?
monetary value.
You know, again,
People.
they were able to run this before without all this stuff on an 8-hour day with the staff, provide good service without all that. So I don't buy the argument, well, this is gonna save a lot of time. It's still an 8-hour day and it's a very expensive thing. And everybody keeps yakking about the budget and stuff like that. I realize I'm talking to the wind, but I'm just saying that I'm not alone thinking of like this. I hear this from people all the time. Mainly people my age, that's quite possibly, but nonetheless, it's just something I'm throwing out, taking it off my shoulders, I guess.
You know, I think part of it is regulations have been quadrupled, or I don't even know how many times. So maybe a lot of the work, the electronic data recording, reporting, those requirements, we probably didn't have as much before.
Right, you get it all on paper, but very
Or
self-serving.
didn't have to do it at all. Now the reporting
Electronic
requirements
medical
are
records.
But again,
ridiculous.
very self-serving to the
Yeah.
people who've got their hands up for the money.
I agree.
So we, and,
I don't know how we back out of it.
well, I'm not expecting it to, but I
Only as
just
a society we have
maybe
to back out of it.
resist it as much as possible. That's all I'm saying. My commissioners over there, so I know you guys are looking at this too, it just,
Yeah, we're not
One of
looking for
those.
more software to run,
No,
for sure.
that's my comment, Mr. Chair. Thank you very much.
well, thank you.
Shut the computers down.
Talking
Computers down, chalkboards. Let's disconnect the
our
Wi-Fi.
arms off.
Disconnect the Wi-Fi.
Back to that.
Zoom off.
All the ledgers and tools.
Yes, number 3 pencil.
I've done that.
Yeah, fill in all those.
Cheaply. Works quite efficiently. And if I don't like it, I got an eraser.
Yeah, but what could do math quicker, you or this?
Me.
One of
Go ahead.
that.
Go ahead.
So anyway, IT systems, we did that one.
Yep.
Pre-employment.
Hosting,
Pre-employment
IT renewals and hosting.
That's what we just did. That's what you
Yeah.
Yeah,
did.
we did that, right?
That's
Pre-employment.
part of it. Thank you. It really is that moment. Pre-employment screening. So for someone to be hired, they have to go through a physical.
Yes, physical drug screen, criminal background check, and if they drive a vehicle, they need a motor vehicle check.
What are the
And-
physical, sorry, what are the physical requirements? What do we need to pass work?
They, all of our job descriptions have
A fit for
lifting
duty.
requirements. And mostly we're looking to prevent workers' comp claims. So they have a we send them to occupational health to be, I don't know how I didn't have one. I don't know what they do to them, but make sure they
They-
are not injury prone, I guess.
So that's about $162 per person.
Yes, we do have it at the hospital now because the facility we were using moved to Concord. And if we use Convenient MD, it's $96 more on the 162.
Okay. Equipment repairs. Yeah, it is what it is. Copier lease and maintenance. Seems like every department has an $8,000 copier lease maintenance. Pretty
A lot
close.
of them do. Corrections,
Is it enough?
sheriff, nursing home, we have one, the courthouse has one. And they're not just copiers, there are, in most cases, fax machines and printers. All employees are printing to them.
Yes, I keep forgetting that. Thank you for
You're welcome.
reminding me. Ability. Property. Primex.
Yes.
Dues and subscriptions.
So here I have a request. I hate to say it out loud, but we did get the bill from the Association of Counties. And it's higher than budgeted in all areas. And in the nursing home, it's $1,000 more than what the commissioners recommended.
What's the reason?
So what happens if we tell them, no, we'll pay you what we paid last year?
Then they will say you can pay it, if you don't pay us in full, you are not members. So
Then what
it's not a piecemeal, then we don't certify our corrections
Corrections
officers.
You want
That's the
that,
big
yeah.
thing. We also don't have them down there
Do that?
lobbying, testifying, educating all of you on bills that affect us. So we will do it ourselves, which will take a lot of time.
You do
And the whole
realize there's a
networking thing.
bill. I don't know if you know it or not, but there's a bill to separate their lobbying function and monies from their
What else?
requirements that they do classes. I don't know if you knew that, but they also have a wraparound on correction office certification. So if you're not a member, you can get your
Part of
officers
state boy.
certified, so then you can have them as corrections officers.
The only people that do certification.
Absolutely.
They're the only ones that do certification in New Hampshire for corrections. It is a monopoly.
Okay, I don't want to be a dead horse. Cemetery plot care. Which cemetery is that? That we,
Oh, that's a cemetery.
That's the
plot,
South Road in Belmont Cemetery. We have a lot there. There's 10 graves. And we have 2, 4, 5 people. We have 5 empty.
we have 5 grave sites. Thank you
You
for that. Advertising. Who do we advertise for?
RFPs, job openings.
Professional development.
We have about 50 staff members that are required to get education for licensing and certifications.
So
We,
could you tell me if I haven't came across it yet? But if we have an LNA or the probability of an LNA, I thought we had money to pay for them to get their certification. Am I mistaken?
we do have that. It's in nursing and education and training. This professional development is for people that are already licensed or certified and they have to renew. Like we have to have CPR renewals, we have to have education provided.
Ongoing annual.
Ongoing, yeah,
Okay. So that's.
like
a separate-
contact
From the
hours.
initial training is
Okay.
paid.
I just haven't got to it yet. Thank you. All right. Any questions so far? Doing good? Travel, that's just going to where you need to go. Office supplies. Postage.
So here we are with the computer equipment again. Did we ever get a breakdown of that? I mean, $20,000 for computers is,
Well, I believe Shelley has said that perhaps we don't need some of that additional equipment, just so you can make do with what you have.
No,
No.
not with what you have, but with
Mhm.
10,000.
No, with
Find it
10
less expensively.
10,000.
We don't need to replace as many as I thought, so we've done the inventory. They don't cost as much as I told you. So, yeah, I did go back and look at that. And actually,
let's find out.
I don't think I brought it, well, I did bring it, but I don't think I need it right now, but anyway. 10,000 will be enough for us to replace the computers we need to
How many
replace.
computers will that replace?
I think
That's gonna
8 to 10.
replace about 6.
Oh.
But there's also dual monitors, keyboards, mice, there's other things, docking stations. So, but it would be, I think. Or what happened is we bought more last year,
Then you need,
Yes,
yeah, to get a jump on this year because we had extra money. I don't have the
And there-
inventory with me, but
The computer's on the 5-year replacement plan.
yes,
So that we don't fall behind.
right.
Okay.
So it works out to about 20% of the computers, but it's really not even because sometimes someone's dies and we need to jump them ahead. Things come up or
Yep.
different staff uses them differently. But this year, it looks like there's only around 6 that the nursing home will be replacing.
So we're back to time clocks as well. I mean, how can we have a guesstimate of what it's gonna cost if we don't know if we're going with Munis or we're going with Kronos or we're going with somebody else?
We're expecting the time clocks are gonna cost about the same regardless of the company. They're not, we have to buy them from the specific company that we are going to use their software. So I don't think that's like a big thing they're making a lot of money on. They're,
You're buying on that.
the software, right, and the maintenance, the annual subscription costs, yes. So this is a quote from Kronos.
Yeah, we did get a number from you
Yeah.
too at the time, and it was
Similar.
pretty much the
Okay.
same.
Estimate. The time clocks the date. Software's. Because most likely the time clocks are gonna be software driven, and if you change software, you're not gonna be able to utilize time clock. Okay. Very important decision for you guys. All right, moving on to. So all in all. The 24 budget. Did well, I mean, year in, projected year in. Is that close to being closed out, or are we still waiting for some things to?
It's close.
It's cool.
It's
So-
very close.
1.9 and change is pretty much it. So that came in under budget, I may know. And you're actually only looking at really a $50 increase. If I'm looking at that, 50,000,
Oh, 50,000 maybe, yeah,
yeah, 50,000 increase.
over what we spent in 2024.
Yeah. Well, even
Less
to
than
what
that.
was budgeted, I mean, 1.913 was budgeted, and you're just requesting about 1.963. Is that right?
We're well,
Is that deducting the,
your,
10,000?
the budget, your work today, you're now at 1,952,946.
What about the computer?
the computer?
I fixed it, that's,
She can go.
Okay.
All right.
yep, I got that.
So that's a 40,000
Yes,
increase
Over last year.
over last year, budget last year.
2% increase.
So that's, okay, just wanted to make highlight that, that's. Maintenance. Is that your
Two,
maintenance?
two full-time people.
Two,
Let's say, what exactly does that include? What do these maintenance guys do? They're not doing projects or anything. What kind of maintenance?
They do taking care of the facility, anything that breaks, the beds, lighting, painting,
They do all the painting?
sanding, salting.
They do the painting in the whole
Yes,
nursing home?
yep, yep. If call lights are
I hope
broken,
they don't do the plumbing. That stopped everything.
yes,
short.
I know, I know.
After the tour.
Actually, we have a master plumber.
I want to know
Yeah, I was
who that
gonna
is.
say they
Shelley.
only what they can.
That was me that did that. I did it on a weekend with my zip ties.
That's what it looked like. Somebody did it. A little rough.
So they're making like 82.5 each
with Benny's.
plus pennies.
Well, it's 102 if you divide.
Why am I seeing 165? I'm in the wrong column.
You have to look at your wage sheet.
I'm in the wrong page sheet. That's my bad.
I'm looking at 103. So
Yeah, I was on the wrong sheet.
$1,000 a week, $25 an hour.
They make 48, roughly 45,000,
Yep.
48,000.
Plus business.
Um, Probably gets closer to 48 and 50 when you add their wage increases. 40,
Yes.
50,000, 48,000.
48,000 and 50,000.
Yeah. 50,000,
51.5.
yeah, and then there's shift differential pay, overtime. Oh, that gets subtracted
Oh,
out,
okay.
holiday.
Waste
Look at your
disposal.
wage sheets in your book.
So waste disposal, we have one less dumpster. Because we've decreased the PPE that we had to have with COVID.
Cable services.
That needs,
We gotta have. That's entertainment.
the cable needs an increase because we just got a bill in December, an invoice that says cable is going up, what, 10%?
So 4,620. That's a big increase.
Who do we do cable with?
Allbridge. It's like senior TV.
Probably get some savings, I'm looking old and not, but I think the drill, they can drill, that oil price is gonna go down. My personal.
Are you looking at heating
Are
fuel?
you looking
Yeah.
at, because that's natural gas.
Oh, that's when that,
First one, the general repairs, 50 grand, what kind of general repairs with that for?
The maintenance and repairs, the first line, you have 50,000.
That's anything in the facility that's not dietary. Because we put a line in dietary
Maintenance
special
and
for
repairs.
maintenance, so that's,
oh, okay.
it could be in laundry, it could be in any nurse's station, reception area, anywhere, fixing anything, light switches, heat covers, plumbing, gaskets, screws, nuts, bolts, plywood,
Supplies.
yeah.
What is laundry ozone? Right below the exhaust.
2,100.
Is that someone coming in to check? the
Yes.
Ozone level?
That has to do with the laundry, cleaning and the exhaust system. So the chemicals that get dispersed into the washing machines.
Did we get the
And they, because I made.
sprinkler system? We never got that addressed last year, did we?
We did get it addressed last year, but gonna get it addressed again this year.
Yeah, the sprinkler system, we decided to pressurize the system and see where the leaks are. They found 15 leaks. They fixed them. Now they just did another issue came up because it burnt out the compressor and they found 23 leaks. That are mostly at gasket areas, so they're gonna have to come in and replace like for like, so gasket and pipe. We never got anybody to do a full bid on it. It was
No one
like
wanted to bid on the
300,000.
project. We got 0 bids. We put it out to bid, big project. Nobody bid on it. The company who does our work and Canadians.
Didn't even,
They said they didn't want to do the job. I guess it's a difficult job up in the attic. It's old and not pleasant, and they declined to bid on replacing the system. Instead, they're happy to keep telling us every year that there needs to be little things, which actually aren't so little, but it
Right.
costs us a lot of money to keep maintaining it.
Kicking the can down the road.
Till eventually we'll be replacing it piece by piece, I guess.
which is kind of what we're doing now.
Is that
Every
cast
time.
iron pipe,
Black pipe,
black pipe?
and some of it was, I think, inferior pipe, like number 2.
The disinfecting, they disinfect the machines with the ozone.
SDPS. Drowned in the. You made comment that your guys do salting. Where are they salting? Because I thought that was.
It's not salting, it's sanding, and they use the the
What are
special
they sanding?
parking lot walkways.
They all do this, the facilities and the nursing home maintenance crew, they all work together to do this whole complex and the courthouse.
Yeah,
You anticipated my question. That's good.
Who's the company that works on sprinklers? Is it
Superior,
Oh, is it?
I think it's Superior.
Building improvements.
Yes, so the mini splits in laundry need to be replaced. There are three failing mini splits in laundry, two fan coil units, which are failing, that produce heat, that go in the hallway, center hallway, before you go into the outside courtyards. And the chiller pumps that is associated with the air conditioning, and the variable frequency drives, the 2 boiler pumps, which is for the heat and hot water, is also, and we just learned on Friday, which I'm gonna ask, and when we get to dietary, the steamer broke. It's not gonna pass the inspection, and that's $10,000 to $12,000 to replace in dietary.
Any other questions? Through maintenance?
We're gonna move on to. All right, you're at the end of maintenance,
Yeah,
down 17%.
I was gonna ask about the electric.
But that's within there is. You said 10,000 for a steamer table.
10 to 12,000 for
Would that go under maintenance?
no dietary.
We're gonna ask you to add that when we get to dietary.
Okay. Rehabilitation.
That's 3 full-time staff members.
The health opt-out here can be reduced. Since open enrollment, instead of 6,000, we only need 1,500.
To that. Dietary department.
Here's
So
one.
Plus
I had-
10K.
Put in 10,000 before because we've been having issues with kitchen and replacing stuff. So that 10,000 that's in there is gonna be right off the bat for the steamer.
Right, so first,
Is it gonna be 10 or is it gonna be 12?
did you say 10 to
10 to
12?
12 is what they told me.
So we'll end up putting it out to bid. Hopefully it'll come in somewhere. Most likely 10 to 12. Let's split the difference.
You need a steamer. It's. If you get too cheap of a one, then it's a cheap one. We
Yeah, we
all
won't
know
buy
what a
a
cheap
cheap
one
one.
does, so
No,
I'm just. Not necessarily like getting our Cadillacs, but. Let's face it, sometimes it lasts longer.
Get what you pay for.
You get what you pay for it, so. All right, any other questions in dietary?
Well, I don't hear anything from you, but if you're willing to put 11,000 in here. To buy a new steamer,
Put that out of new
Right.
equipment.
10?
Give it that.
Yeah, you guys talk about it. Sorry, give me a number.
For the
And-
new equipment,
Yes, for new
Yeah.
equipment.
I wrote down 12, so.
Steve. You could see that.
Okay.
Anyone else? Come up with a number.
Yeah, we're there. Going once. Do I hear 9.5? Do I hear
you said
7?
12, and you said 10. Let's do 11. No.
11?
Curious. You said 10, you said 12, let's do 11.
Because
11.
one of you has to convince one other person to agree.
11?
11.
Wrote down,
I'm convinced.
I used the other end of my supercomputer.
I'm going with 11. I'm ready.
The chips a little slow over there.
Shelley, how old is that steam table, do you know?
Ooh, I want to say maybe 15 years.
It's that old?
Yeah, yeah.
Okay, now, contracted dietary services. The question came up before when you, maybe it was in your first meeting about the nursing home. How could we do it on less money than we did last year? And we can't. So the Glendale, our company, sent a revised bill October 29th, 2024, after the commissioners had already made their budget. And the actual cost is $1,516,055
For what?
for the food service.
Would it be cheaper to do it in-house?
It would not be cheaper to do it in-house, and it would
We can't
not be
find staff.
possible.
Yeah, we just can't get the help to
We
do it.
can't find staff.
Mhm.
It's 3,000 more than we spent in 2024, which is, I'm kind of surprised it's only 4%.
I'm surprised it's not higher with the food inflation.
Right, between the cost of food and their wages. They could keep it to a 4% increase, I thought was pretty good.
Right. Yeah. They knew.
Any other questions? Thoughts, opinions? Moving on. Nursing department. He is a current employee.
While she's counting those, I can tell you that, there was an error in the wage number. If you go down a little ways, there's wages office. There's a position in there that Shelley has notified me is not going to be filled. So we can take that right out of the budget.
Which one's that?
And
Wages office,
51,900 is the number.
right. And that can be reduced to $176,850.
So
And that means that also affected the health opt-off incentive, up a few accounts to line 51,500. Health opt-off, that can be reduced to 110,300. And the
52.
sick time incentive right
Because
below it
these-
can be reduced to $460. And the health insurance needs to be increased to $1,164,500. I know,
Then-
but that,
then-
you can see in the health opt-off, you save $30,000.
Yeah.
But the health insurance is going up only 2,000. So total, this is a good decrease.
So how many people work in this
16.
wage office?
Rate
In the what?
Yeah,
in the, these are really in the,
I think it's
business
39.
office. Three.
can say 50, because we.
And
just
that's
hired-
after minusing
Other
one.
dog.
Yes. We had budgeted for 4, and was a second unit clerk, but she's not going there.
So full-time nursing was 49.
49 full-time employees.
How many open recs?
In the budget, there's maybe 8 or 10 positions.
13, 14, 15. No, there's
Oh.
more than that. There's 13 LNAs. 1 RN, and I know, sorry.
That's okay.
16.
16 what?
open positions.
13 LNAs doing by,
Here, I could go through them. With the RNs, there's 1, 2 RNs. Now, the thing about these positions, one of these RNs, that actually just left.
Yeah,
So we have her budgeted for 42 weeks, because we had paid her predecessor for 1. The other vacant position, we are only budgeting for 2 weeks, so we're only assuming if we can find anyone through some crazy act, it would be at the very end of the year, and we only have budgeted for 2 weeks for that person.
Now, why are we saying if we can find somebody through a crazy act? I mean, shouldn't we be out there trying to find people?
We should,
Instead
but
of praying for people?
we are
We
trying
do.
all the time, every day.
4 people.
Every way that anyone has ever suggested we try, we are trying.
And have somebody stand in the room in a costume with a suit saying, we are.
And this position's been vacant since January 25th, 2023.
We hired 4 people last week.
Right.
Yes, this is an RN.
so there's 2 RNs that are missing.
3.
Yes, since January 25th, 2023.
Do you think it's because of the pay that we're not getting them, or do you think it's
No.
just because they're not there?
They're not there. They're not in the state of New Hampshire, possibly America.
There's
Would
one,
the pay that we offer, if they were there, would that get them to come in?
I think our pay
Our
and
pay is
benefits
good.
together, our compensation package is pretty good. I feel that it's competitive, especially for these
I think it's good.
nursing positions. It's not the pay. We have not turned anyone away because we couldn't pay them enough.
Is it the lack of housing? Is it the lack, I mean, there has to be something.
I think it's maybe it's housing to some
Have you heard
extent.
from anybody? But gee, I'd like to work here, but
I don't think so. No, we can't get people
No.
through the door. Basically, if you walk in the door in the nursing home, we're gonna hire.
We interview everybody and we hire everybody. We
Yeah,
give
what
them a
about-
chance.
she covers all this, but what about, what's this one? nurses that are in nursing school, do they send them out to work?
We have people right now that are in nursing school that will graduate in June. And we have one that'll graduate next year, and we have one that'll graduate in December.
And do they get paid? while
Yep.
they're here?
They're getting paid, they work 24 hours and they get paid for 40, they get full benefits. We also pay their tuition. And when they're done, LPN is 2 years commitment and an RN is 3-year commitment.
That's good to know. I don't think many people in the public know that. I certainly didn't know that. Usually we just hear that you don't offer enough in pay, which is why you aren't able to fill the positions.
Yeah, nursing, that's not been the case.
Shortage.
Yeah.
There's a huge shortage and there's a shortage of instructors, so that holds back classes. We just have an LPN class that started River Valley finally in Manchester is their satellite class, and we got somebody Friday that we hired that will do 32 hours part-time and then become a nurse when she's done.
She knows that better than I do.
There's 3 classes of nurses, LNA, RN, and there's one in the middle.
Oh, LPN. Yeah.
LPN,
Okay.
LPN or med
I
tech,
thought he was talking about-
LPN.
Yeah.
How many?
LPN, are you talking about LPN or
Yes,
med
how many
tech?
vacant?
Oh, he wants to know how many vacant LPNs. One.
13 LNAs, 1 LPN, 2 RN. I'm missing.
One,
Aren't filled.
6,
We-
7, 8,
yeah.
9,
We
10, 11, 12,
have agency.
13 vacant LNA positions.
You have no traveling nurses here.
You
Yes,
only-
9, yes.
I didn't see it on here, so that's a separate line. Or is that,
It's a separate line
okay,
because they're not our employees.
This contract nursing,
contractors? Oh, yeah, okay.
Yeah,
I-
It's a big
53
line.
300.
Yes.
1.6
I
million.
see that.
Okay. Which I think they get approximately 125 on the short end an hour. Thank you very much.
And how many traveling nurses? I'll wait till we get this. So,
And just as you're looking, if you're looking at these vacant positions, I just want to emphasize that few of them are budgeted for 52 weeks. 26, 26, 26, 2, 2, 10, 2 weeks, 20 weeks, 26, 10 weeks. These are just guesses. But we need some money in there, but obviously don't need to fund them for full years. We don't think we're gonna be able to hire them right off the bat.
what if you did?
Then if we could, we will come back and ask for more money. If we got to the point where we felt like we have more people, we have applications to choose from, and maybe they're able to fill all these spots, that would be a reason to ask for a supplemental
Because
appropriation.
the chair just said to me that it would be approved, so.
I would think it would be if you
Charlie
tried.
would come for a free meeting.
Yeah, just said, so I'll ignore it.
Those nice.
Because by filling these positions, it would increase the
income.
beds, then that would increase the revenue, which would then offset the differential between the revenue and the expenditure.
And the state would be thrilled because it would increase their
The
bed
bed
tax.
tax. So it's a win for everybody.
Has to retire.
It's actually not a win for us because we did talk about this a lot, but if you build essentially you could get rid of the contracted nursing and fill all of our positions. It's 44 we would need, and the cost to do that is gonna be about $2 to $4 million more than the revenue you would generate by filling the nursing home. So it's still not really a winning
Well,
proposition.
by 50%.
It would be a win though, because
You
you
lose less, yeah.
Instead of losing 5 million,
Right.
lose 2.5 million, and we'll accommodate all those extra people.
And
That's
most importantly, all what you just said, we'd be accommodating more Belknap County residents, which is so important.
That's what we're supposed to be doing.
Okay,
Okay.
as we move on. Dental insurance, payroll tax, retirement and employment. I'm gonna just read down the list until someone.
Well, so it's
Workers'
not-
comp, recreation,
That's recruitment.
recruitment, I apologize. Do we use a recruitment service?
Not yet,
No,
but we've
Are we
been
gonna
asked to
use,
check into.
let me reframe the question. Can we look at using a recruitment service?
Yes,
Do we know about how much that would increase the recruitment line?
no, not yet. And it's really highly unlikely. Usually, if we are gonna pay a recruitment service, that must mean that they have nursing staff looking for jobs who can't find them, and that is highly unlikely. But we are going to ask.
Yeah, because that doesn't, we don't actually pay them until they
So we
provide.
hire them, right?
Okay. Employee recognition. Contract nursing, I think we had a brief conversation over contract nursing. Medical supplies. Oxygen. RN program at 16K and one at 8K.
These are the nursing education that you were referring to earlier. This is to get them to become nurses or LPNs or LNAs to get their certifications.
And out of curiosity, do we use the Lake Region Community College? I was out there on the tour and I saw a beautiful setup and everything.
we have one student in the RN program.
Cool. They also do the LNA type stuff out there too, right? They can train, what, 8 people per class?
Yes.
They got 2
And
classes
the
going
cost
on
is
there.
reasonable there. It's 14, I think, 1460, and LNA Health Careers is 2,000.
I was gonna say 2. Uniforms. Interdepartment allocation. New equipment. That's. Any other questions over nursing? There being none, we'll move to laundry.
There are 2 full-time staff there.
What's the Department of Corrections? and everything?
Correction.
Yeah, never mind. Any questions about laundry? Moving on, housekeeping.
Housekeeping has six full-time, 1 part-time, and another part-time person starting February 5th.
That's in this budget, correct?
Yes.
Yeah,
And that's your full,
that's full complement.
that's a. Like to hear it.
We do have a change since open enrollment happened in the health opt-out incentive. That can be reduced to $4,760. But the opposite problem with health insurance will go up to $110,950.
You said that this is, all of the positions are full.
Yes,
Is that full for 96 beds or is that full for 62 beds?
that's full for 94.
So
It's 2 part-time and 6 full-time. One,
but that's
one,
enough staff.
that's enough
to
staff
accommodate-
for, we have a full complement.
To accommodate 94 patients. And we only have 62.
But we also have a lot of more clean, we have to clean the rooms to get them ready and infection control to get beds moving, to move people in and out.
By that,
It's also a very
Well,
hard
it's
position
hot.
to recruit for.
more of a numbers
So if
guy.
we lay them off now and knowing that
You're not gonna get 'em
eventually we're
back.
need them back, that would be very
Depends if it's
difficult.
2 years or not.
Well, right, if it's,
Yeah.
if we'd done it 4 years ago,
And we constantly have part-time leaving, coming, going.
turns over.
The turnover is frequent.
Can't imagine it's a very pleasant job, quite frankly, so. If you were to increase the workload on them,
Yeah, it would definitely.
So when we get up to 94, they're gonna squawk, is that what you're saying?
Probably, but walking we can live with. Vacancies, that's.
The retirement and employment insurance, workers' comp, general operating supplies, uniforms. How often do we replace them?
You're entitled to a uniform
Stipend.
allowance every year by their union
Yep. Our
contract.
contracts, yeah.
Good.
Pretty standard.
Any other questions with housekeeping? Any other questions with housekeeping? Nope. There being none, physicians and pharmacy. Physicians,
So physicians, that amount is for our medical director. We have a company, Theoria, who provides us a medical director and a nurse practitioner or a physician's assistant to come in and see patients. So we have patients seen at least 2 to 3 times a week. Do you want me to keep going?
just out of curiosity through all of this, we get reimbursed for a lot of this, like medicine and dentistry and,
The Medicare A
yeah.
is reimbursable. It's in revenue. The
That
dent,
the 226 is in revenue.
yes, the dentist, we do not,
Okay.
but we
Yeah,
have to provide dentist and a podiatrist.
I haven't figured out my Medicare dentist, I mean, because it seems like when you lose all your teeth, you become sick, and once you become sick, you cost them more money.
Right.
Maybe I'm,
We just started the new Medicaid program and we've been very lucky. We've got a pair of dentures for somebody. We're one of the pilot facilities that we were able to find an oral surgeon in Manchester, get teeth extracted and be able to get the person a pair of dentures.
nice.
It is.
Medicare B reimbursement services, 181, is that revenue or is that expense?
It's expense, but there's an offsetting revenue.
Offsetting. Okay. Now ambulance services, that isn't that reimbursable through?
No, if we have, it's for a skilled resident. If we have a resident that is here for skilled stay and they need to go to a doctor's office or a CAT scan or an MRI, we pay for that. for them to be transported, not 911 if somebody had to be sent out in case of an emergency. But if somebody came here, a skilled resident is somebody, we pay the whole bundle. We pay their medicine, we pay if they have to go out for testing.
What is, forgive me for my ignorance, but I don't know what a skilled person.
So somebody that's using their Medicare A benefit, if they're in the hospital, say they fall, break a hip, break a bone, maybe have a urinary tract infection, something that's going on acute. They have 3 midnights, then they can qualify to use their Medicare A benefit. And Medicare A will pay up to 100 days as long as somebody is making gains. The first 20 is 100%. Day 21, it becomes an 80-20 copay. If you have a secondary insurance, they pay the 20%. If not, then the patient is responsible for $209 a day for the copay.
But they're short term.
It's an acute
Short-term
stay.
rehab,
Yeah,
right?
yeah, sorry, yeah.
As opposed to our long-term care residents who are here to live. These are people who come here for short-term therapy so they can leave again, ideally.
And we have had some that will end up staying.
Any other questions, other positions?
Once we go to, I mean, most of this stuff is already salaries and fixed rate stuff that we get.
Activities?
Activities, there is 5 full-time staff members.
No opens?
No openings.
So, do these activities take place 7 days a week?
Yes.
But
And there's one that works till 7 o'clock at night. Actually, now 8 o'clock. 8 to 8.
Any questions on activities?
Oh, we have a request for health insurance adjustment based on a plan change. To increase from 125,000 to 130,500.
Looks like it's 101. 125 is the commissioner's recommendation.
Any other thoughts? Hairdressing?
We have one hairdresser. She works part-time, 24 hours.
24 hours a week.
Any questions there?
No. That's every week? Talk to a guy gets his hair cut 3 times a year.
Come on, so, yeah, it's so beautiful.
Yeah, wouldn't know.
Exactly.
Can- Do we have a revenue page
You do.
Yeah.
for the whole shooting match or just?
I believe you have one revenue page in your book for all revenues.
You gotta sort of-
Yes, I have them right here now. County attorney has a grant program. Like he's bringing 79,999. I wonder why that's not reading again.
You're the
Make it
whole
80.
county or just the nursing home?
Huh?
You're gonna do the whole county, or just the
Yeah.
nursing home?
Oh, you wanna do, you're gonna do them all
Do them all.
sooner or later.
We did some of these already, I know.
Yeah, I don't think you made any changes, though. You did talk about revenue in the sheriff's department.
Yeah.
That's the only one, I believe, that you talked about. County administration, this has gun stock revenue. That's expected to be 350,000. Unanticipated revenue is 100,000. It was last year. Rental income, that's the courthouse rent. We get rent from the court system and also from probation and parole. Insurance, this is if our insurance company reimburses us. Opioid abatement fund. This is where we are expecting to make a transfer out of the opioid abatement fund to offset the cost of a piece of new equipment that's in the budget for the same exact amount. It's a full body scanner for corrections. Hopefully will prevent people bringing drugs into the house credit. Interest revenue is down. That's primarily the loss of our ARPA funds that we had invested in the bank.
Yep.
Also, the interest rates are down. The commissioner's recommendation is to use 1.2 million from fund balance. We can talk about that later. Let's see, registered deeds. You had anticipated $900,000, the same, oh, it's a little less than last year's budget. Yes, it's a little less. That's just based on the trend. Her equipment reimbursement account, she basically reimburses the county for the cost of her equipment that she leases. L-chip fees she receives from, those come from motor vehicle registrations. Sorry.
The percentage of all of the filings she makes.
All right. And miscellaneous income is like copier charges. The sheriff's department, I think you did go through these.
Did I know? Yeah.
Fees, court security. Outside details is the offset to the expense.
Yep.
All right, corrections, inmate reimbursements. What makes that up?
It's for their commissary, and I think when they order that. Or no, I'm
No.
sorry, that's down below, so I can look.
All right, I'll go on. Work release is when they pay us when they are put out on work release. Electronic monitoring, they pay for the cost of their bracelet that costs to them. Commissary income is a percentage of their sales when they order supplies. It's miscellaneous. Last one, I think, came from Social Security because we notified them we had somebody and we got kind of an incentive. Restorative justice.
Can we stop
Yes.
just for a second with corrections?
Yes,
Electronic monitoring
yes.
is 10,000. That's for the cost of the bracelet.
It's what the inmates pay.
For
They
the
reimburse
bracelet.
us for the bracelet.
Remember they spoke about that they pay us,
Yep.
that they pay for their own.
So who pays for the actual service?
The county pays it and then we charge the inmate and they reimburse it.
For the monitoring and the bracelet?
Yes, the county pays all of it. We charge the inmate for the bracelet, for the use of the bracelet.
So we get the bracelet back, right?
Yes, it's just rented,
Reusable.
yeah. And frankly, if anyone couldn't pay it, it's well worth it's worth it for the county to let them be on it anyway. Because it's a lot cheaper for them to be out than to be in.
Okay.
Back up to reimbursement.
Haircuts, drug tests, and postage and things like that.
Okay. Thank you.
So if I can go back up to county, I was trying to catch up, trying to read everything. Why are we gonna get on the opioid abatement? It's gone from 20 to 142, so it's 122,000 increase.
This isn't what we get from the opioid abatement money. That money goes into a separate fund. When we get it from the state, we put it in a separate fund. This is, we're gonna take out 142,000 of that money and use it this year. So it's a revenue. We're also gonna spend it. So it basically just gets run through the budget. We're gonna spend 142,000. We're gonna get it from our opioid abatement funds.
How much do we have in that fund?
I think 36 or 140,000. And we'll get more this year,
Okay.
or maybe we have, yeah, anyway. We have at least, we'll have easily enough to cover this.
162,000 and change.
Restorative justice, we can actually increase this revenue. That grant number. That's. Okay. So maybe we could. Yeah, we can make this 25,000. Because this is 1 year, the state has a new program and they dramatically increase the amount we're eligible for.
From 2,500 to 25,000.
Yes,
You sure that isn't gonna get cut at the state level?
I'm not sure of anything at the state level. I only can tell you that they sent us a letter and said you have received, they've actually sent us the first half for 2024.
I'd be careful on what you're planning on from the state.
I'm counting on you.
Yeah.
It's a fine line I walk.
All right, Health and Human Services. We received a percentage of the $5 million cap amount or credit amount. Our share is estimated at 230,000. And recoveries is the state sending us money that they recover from years. It's old. Seems like but it's mostly, I want to say welfare money they gave out that they're slowly recovering, but I'm not sure exactly what it is. They collect it every month, they send us our share. Yeah, any of these could stop.
Yeah, Harry, it's not any of that.
You can't spend what's not in the bucket.
They just need to let us know, or it'd be nice if they'd let us know.
You know,
All right, nursing home revenues. We are anticipating less pro share money than we received last year, but more than we have traditionally received. Resident resources, you better take a look at the actual,
Oh,
what they are.
resident resources, 800,000. Yep, resident resources is, 401ks, annuities, bankers life, it's social security except for $74 that has to go into an interest bearing account. Is that what you were
Yes, that's
talking about?
very good.
And Medicare, Medicaid. So Medicaid is what we get paid for the state. And right now the Medicaid rate per day is $283.
So we're thinking that could go up.
That did go up January. It'll go up again July,
So
but it'll
you
go
would-
up as our census increases,
So you could increase that from 3.4 million to 3.9
3.9.
million, which will help your bottom line.
Medicare Part A, I think, the 1.1 is a good number. Medicare Part B, we're close to what, 250?
Yes,
I think we should be able to increase that
from 210 to
to
250.
250. Private pay, we now have 10 patients that are private, and I'm looking at 2 more. So I think we can go up to 900.
Isn't that dependent on whether or not you find any nurses?
No, we have right now in-house 2 people that will be changing over to, so they're in the numbers.
That equates to $95,000.
$350 a day.
Yeah.
You're about 100.
Okay, thank you.
Medicaid incentive, I think the number is good there. Co-insurance, 195, same. And 50,000 for co-insurance B is a good number. Sales, meal
Yeah, meal
sales,
sales.
500, that, I mean, it depends on holidays and, visitors, yes.
The family
Family.
members paying for meals to come and eat with their family on holidays.
Are we able to come in any other time? To eat with the family,
Mhm.
are they charged for that or?
$3 for a ticket, or they buy a block of tickets.
That's good, that's nice.
All right, so let's see. Just to see where you are right now. Sure. What's that number you have there?
Yeah, you haven't saved and I'm here to read only.
Oh, okay.
Right.
So now you are at. So the amount to be raised by taxes right now is 22,977, 8.4% increase. Another thing that we looked at today is the amount to be used by fund balance. And so, the policy, the commissioner's policy and the prudent policy is that we would want to keep between $3.5 and $5 million. So we have just about 5 million. Yeah, this is not audited, so. And that we wouldn't want to use more than we added in. So it looks like we'll be adding in 1.4 million. So you could maybe go, if you look at if you use 1.3 million. See the impact of that. On taxes brings you down to 7.9%. It's below 8. At least that gives you an idea of what all the work you've done so far, where you are.
So we got down 5%, so.
Like I've been telling you, they want us to reduce the budget, the state budget by 8%. We're still talking about an 8% increase here.
I hear that.
I'm just
loud and
throwing out a
clear.
number. I'm just throwing out a number and.
I'm
stating
glad
the
I don't work
fact.
at the state.
Any other
No,
questions?
I wasn't gonna.
So we're done with nursing?
Revenue.
We did revenue.
We
either.
just did
All done?
revenue, I thought.
Yes,
You're all set with that?
Yep.
Not-
So thank you.
Okay, I didn't know if you wanted to know the difference between the Med A expense and the Med A revenue, what we,
Okay, if you want to explain that, that's fine.
if we look at the Med A, what the expense was, 227,849. And the revenue that we took in was 970 plus the other 178. We made 1.148, 1.1 million.
Yep.
And then Med B, it looks like it's gonna be projected 220,310. And we took in 250 plus Med B co-insurance 45, so that's 295.
Here's another interesting thing. I don't know if that will make you feel any better or worse, but just looking at the nursing home, the amount that the taxpayers pay for the nursing home, because they're paying based on the budget, less expenses that you're gonna eventually sign off and send to DRA. So it's been for 2022, the nursing home cost was $1,415,000. For 2023, it was $2,390,000. Then it went up to 3.8 million. The commissioner's recommended budget would have had it at 5 million. After your work today, you've got that down to 4,474,000. So I mean, the cost of the nursing home is definitely going up. It's costing a lot more money to continue providing the same service. But you made some good headway with it today.
So that's from all of our meetings, not just from today.
Well, this is just looking at the nursing home.
Just nursing.
Yes.
Mr. Chairman, if I may, as you know, there have been some changes in the budget lines since the commissioners did their budget session in November. And we have a commissioners meeting tonight at 5:15. And under the terms of that itinerary, it looks like we can realize an additional savings of $236,000 on the overall budget, which would bring that 8.1% number down, I believe, just under 5% of 4.9%. Now, this is all preliminary and premature because the board has not met to discuss it. But my guess is there'll be a consensus.
Can you say it one more time, just, so you're saying you could potentially lower it from that to how much?
We believe we can go from an increase of 8.1% to 4.9%, only because in the 8 weeks since the board of commissioners sat down to adjust the numbers, there have been some savings realized that we weren't aware of. There have been some expenses that we thought would be necessary, but will now not have to be incurred fiscal year 2025.
Did you get all that back there?
Doing my best.
Okay,
So,
So if you want to hear what those are.
it's pretty important.
sure.
Go ahead.
Go ahead.
Okay, can I have that list? I gave it to you now. Yeah, okay, thank you. All right, if we look at nursing home administration dues and subscriptions, and I'll just put them on the screen, that will help, thanks, save some time. See if I can find them. All right, dues and subscriptions. This American College of Healthcare Administrators, the nursing home administrator that's informed us she doesn't need that 2025. That's only $300. It's a start. Okay, new equipment. Oh, you already got that. Okay, that was gonna be the computers. So you've already taken care of that one.
Deb also. The CLIA waiver.
Building improvements. In maintenance. Building improvements. This lead lines, electrical lead lines to the generator, that project does not need to be done. We had a different vendor come in and look at it, and said, I don't think we don't need that. That'll save you 15,000 there. Big one is contracted nursing services. That 1.6 million. we think can actually be reduced to 1.3 million. And that's based on the new nurses who are coming in, a couple in training,
Yeah.
and a couple of offers have been extended. I know, I'm saying. You guys are,
Sorry.
that's great.
We're like,
Both of you on both
let me
sides.
fix this.
That's all.
All right, and also in nursing, these two pieces of equipment, the chair scale
And the
and
bladder
the bladder
scanner.
scanner. The chair scale probably isn't needed. The bladder scanner can be reevaluated next year.
Do you have one? It's just,
We have one. We have one, so we can share it on both sides.
And by making those changes brings you down to, a 4% increase on the total. That's what you were talking about.
That was working.
All it could be, I have it rounded to one. All right, 30, I missed where I was.
I'll make it better.
Agreed.
All right, so now that brings you down to 6.4% increase in taxes, which is probably not as much as you want. I mean, nobody wants it to be any increase in taxes, but we do. You know, when you think 54% of this whole budget is labor and benefits, wages and benefits, which is going up, where there's a cost of living increase, there's a merit increase, right there is more than 6.4%. So to hold the whole budget steady at that, and that's based, our cost of living is based on the consumer price index. But yeah, hard to keep providing the same service. And if you consider that every single thing we're buying costs more. I don't know how the state is gonna do it, and I applaud any effort. But,
the CPI is 2.9%,
well, it depends when you look at it and which
but
measure.
for the most part, that's the number you just quoted.
No, ours is 3.4. That's what we had to use for our
That's what you
union
used
contracts.
here, but it's.
Yeah.
It's really 2.9.
You're using
No,
2.9
ours-
Concord?
Yeah, we're using 3.4 by union contract. It's based on the consumer price index, the Northeast region urban for the month of August, the 12-month change since the month of
Right.
August.
Like this merit increase. The one that keeps going through my head over and over and over. If you're over there in the jail and you keep that guy behind bars all year long, and then the next year you keep him behind bars all year long, how did that merit increase?
Well, we don't rate them on whether or not the inmate escapes. That's not how they are
Well, I think-
evaluated. They're evaluated on many other factors of how they do their job, their accountability, reliability, do they show up on time? Are they interested? Are they committed? Are they dedicated? Do they engage in any training this year?
Because when
there's a
that
lot of
turns
other
around,
factors involved in being a corrections officer than don't let the inmates out.
but that goes back to that CPI, they're supposed to take care of that, in my opinion.
It is supposed to make sure our wage scale doesn't slip
But
behind.
it doesn't
again.
slip, it just stays even with the population.
Right, with the market.
So
yeah.
that brings me back to the merit thing. It should be, I can't change this, I don't think, but it should be one or the other, not both.
We've been that route over the years, and we are once again right back where we were before, that in order to retain our staff, we have to keep paying them more money. That's just all there is to that.
I thought we got a kind of equal last term.
2 years ago, you got them equal when we did the compensation study.
We kept the employees up even with the population.
Right. We had a
That's what
company
we
come
did.
in
We
and
did a lot
say,
of increases last term to get up to there. Now I'm thinking that we want to kind of stay even because we're where we should have been last term. I don't want it to get back lopsided in the other direction.
We're already slipping back in the wrong direction. We're not, don't worry, nobody's getting overpaid here. That isn't happening compared to the market. Because, and our evidence of that is in hiring. We can't hire anybody at grade one, at step one. We just had this happen, I don't want to talk about this. But employees are saying, I already make more than that. And you want me to quit that job and come here? You know, I need a raise. I'm not gonna quit a job and come work for here where I make less.
Right.
So I've decided that I can't make one side or the other happy. So I figure I'll irritate both sides equally.
Job,
That's about as even as I
job
can
well
come.
done. You're not irritating us, though. I don't wanna cause you to try harder.
No, I wouldn't do
Don't
that.
try harder.
No, I want right down the middle, just as even as it can get. Fair. That's what I'm looking for. I'm not the chair, he is. Here, sorry, I didn't mean to get off on a tangent or anything.
That's fine. So. I think what we would like to do is, this will not be our final meeting.
Okay.
All right, we would like to go ahead and schedule another meeting for February 19th.
Oh,
There's
wait a minute.
one for February 11th.
So you're not gonna have the delegation meeting that you already,
That's the second meeting.
that's
We
our.
moved that to March 5th, potential.
Good, I won't be here tonight.
That would be March 5th is the delegation meeting.
You can't be on
And
there.
then March
can't be here for March
19th would be our last budget meeting.
Oh, I think it's Zoom.
All right, your last budget meeting will be February 19th.
I was gonna do it the 17th, but I'd be here by myself.
You would.
So
February
February.
by yourself.
February.
Was this-
What was it?
Is that during the day?
February 19th.
The February 19th meeting will be at 2:00.
2 p.m.
I
don't know. what-
We're gonna go over the final things that give us a chance to,
Oh, that's a Wednesday?
it's a Wednesday.
19th is a
Because
Wednesday,
the Monday is a,
and the 5th is a Wednesday of March. Is that-
we wanted 3 weeks to go clean up and do what we needed. With the numbers, I want to verify everything with the numbers and stuff. And so I wanted to do it the 17th, but President's Day precluded me from doing that. So the next closest day would be a Wednesday currently on the calendar. And then March 5th seems to be, if we throw it out there, we have time to adjust it a little bit, but go ahead and get it so that everybody can start complaining about that thing.
What time is
We'll get in
For the
touch.
delegation, that will be 6 P.M.
Deb,
Yes.
he and I'll talk about that March 5th date and see if we can individually talk to people and make sure that we can get enough people here to the,
Oh, okay, all right.
at 18, I'd like to get.
But that would be 6 P.M.
Okay, so we'll talk about that. We'll finalize that date.
All right, that's a long time away. Why do you have to
Well, I'd
wait
have to be on
4
Zoom
weeks?
on that, so you know, if it's on March 5th.
if you have to Zoom?
I would have to, if it's on March 5th, I would have to be on Zoom.
So we won't cancel it until then.
Charlie, you can't Zoom if we don't have the technology for you to Zoom. Remember when
You're
all
right.
the technology?
You're absolutely right. Therefore, I won't be using it either way. I can work with it.
So,
Yeah.
Yeah, telegraph.
Not telegraph, the horse.
Oh, the horse and carriage.
All right. So is there no way to move this budget meeting earlier than the 4 weeks away?
the budget meeting would be about 3 weeks away.
Yeah.
And that'd give us time between all the different things we're doing, to give us time to,
Trying to find that line.
there might be another dollar somewhere.
I'm afraid you're gonna lose your balance walking out.
I don't drink.
And after y'all finish what y'all are doing tonight, I can give you a call and then maybe I can get within the next couple of days, a more updated sheet than what I'm working with.
Yeah, I can send it to you now because nothing's gonna change.
Oh, it is tonight when they have their meeting.
So
You
they
read
just
that?
offered up.
Yeah.
Well, unless they
just-
yeah,
So
unless,
wait until after
okay,
they,
okay.
and then
Tomorrow
you can
I'll
do
send it
that.
to you.
So with that, I'm gonna go ahead and move to public input. Is there anybody from the public that has any thoughts or opinions about what was discussed today or in previous meetings or? Let the record indicate no one from the public wishes to speak. I guess that brings this meeting to a conclusion. Thank you, everybody.
So, Mr. Chairman, we're not meeting next Monday.
No.